Hi, everyone, and welcome to today's episode of the AOCPMR podcast. I'm Meghan Mardashti, one of the AOCPMR Multimedia Committee Co-Chairs, and your host for today's episode. It is February, and match season is upon a lot of our listeners. Whether you're a fourth-year medical student or just starting your PM&R journey, this episode is one that is definitely worth saving and coming back to. For the episode, I am joined by Dr. Benjamin Seidel, who is the program director at UT Health San Antonio, as well as Dr. Shahana Momin, who is a third-year resident at UT Health San Antonio as well, and a prior podcast host here with the AOCPMR. Thank you so much to you both for being here. And before we dive into the questions, I just wanted to turn to you both and see if there's anything that you'd like to share.
Sure, I can start. So one, I've never been a podcast host, so forgive me for for not being as veteran as these two other individuals. And the second is that I do work for the VA and I do work for the federal government. So the opinions and the views that I'm going to be expressing herein do not necessarily state or reflect those of the United States government, and won't be used for any advertising or anything like that. So this is my opinion as program director and separate from any federal connection.
And I have no disclosures. I wish that I did, but I'm just a PGY3. I hosted this podcast when I was an MS3, actually, so full circle here. And it's great to be back. I am at UT Health San Antonio, as Meghan mentioned, and will be applying for Cancer Rehab Fellowship this upcoming year. Excited to be here.
Wonderful. Alrighty, so let's dive in to the questions. So our episode is about matching and making your rank list. And what factors do you both suggest that applicants should prioritize when ranking programs beyond prestige and reputation?
So full disclosure also here, I am many years out of residency. I may look young, but I'm older than I look. So I'm going to let Dr. Momin start here.
Sounds good. I'm a few years out, but I still remember this process like it was yesterday, just because it was a really big part of applying for residency, becoming a doctor. My important things besides prestige and reputation, which I ultimately realized were not really big factors for me to consider. And I think that's something that other students shouldn't necessarily put a huge emphasis on. I think what you should be looking for is a program where you feel comfortable being yourself, where you see yourself fitting with the personalities of the other people that work there, with the attendings, with just the general culture, because I think that's really where you'll thrive both personally and professionally. And I think if you choose a place just based on, prestige and reputation and you don't feel comfortable there, then the reasons that you went there, I think at the end of the day won't really matter. So I think finding a place that fits who you are as a person and that can help that journey of both, personal, professional, and that balance, I think is what's going to matter the most. And I think so many, almost pretty much all PM&R programs are going to make you a good general physiatrist. There's so many great programs out there that I think ultimately picking a place that you fit is the most important thing.
Yeah, I'm going to echo that too. And I just wanted to emphasize from a program director standpoint, if you are going to an accredited residency program, an ACGME accredited program, there are bare minimum that they all need to make sure that they give to you to provide that background. So the fit and how you feel personality wise with the program is really important. And and I tell this to every resident and I tell this to every student, and I probably will say it like 2 or 3 more times in this podcast. But you can make a program work for you too. Even if you make your rank list and it doesn't end up being exactly what you want, in the long run, you're still matched to a program and you can really shape it to your benefit too. So I think
Go ahead.
go ahead.
I was just going to say that those are wonderful insights because I know, from the applicant, the medical student side, there's a lot of concern at times that then goes into, oh, can I then get a job down the line? And that seems to be, I don't want to necessarily say the opposing side of the to this question, but that's a concern that, oh, does the rigor of the program then down the line kind of influence the type of fellowships that I can get into or the type of jobs that I'll be able to apply to? Do you think that matter at all, or?
By rigor of program, I interpret that to mean that it's the difficulty of the actual program itself, which could mean long hours, which could mean
Mhm.
a lot of call necessarily, which doesn't necessarily translate into a job in the long run.
Right.
And in terms of prestige, in terms of like the quote unquote ranking, the national rankings of programs here and there, maybe, it may have some influence in terms of fellowship matriculation, but
Mhm.
jobs in general, I think we have way too many patients and way too few doctors. There are going to be plenty of jobs anywhere for people.
Okay,
I also
awesome.
think just this, oh, sorry, I was just going to say, I just think that those rankings, in terms of like academic rankings, and I think are important for, metrics, research, all of these things. If that's something that's really important to you, then that's something that you can consider if you like kind of doing all these things. And but I think making sure that those values kind of align with the rest of how you feel at that program, or how you feel about that program, are also important.
Mhm. Absolutely. Another thing that's kind of being echoed in what you both are highlighting is that this is 4 years of your life, right? That you're going to be spending with these people. And I think fit and how you feel, like you both highlighted and pointed to, whether you're, connecting with the attendings, the programs, the residents, that in itself, in the long term for your, not only your mental health, but for your professional growth also can take you much farther rather than highlighting or kind of like ranking a program just for name, when in reality, you may not be as comfortable as a quote unquote less prestigious program.
Yeah. Yeah, that's a really good point. And remember, 4 years is 4 years, but it's also 4 years. So
That's
it's it's not a long amount of time when you think about your career in general.
mhm.
And I would say like Dr. Seidel and I have had conversations about just like our time in residency. And, I'm still living
Mhm.
it, but it's been some of the most fun years of my life. My co-residents are some of the like best friends that I'm going to have in life for the rest of my entire life. And I'm really grateful that I picked based on fit. And I basically prioritized that so highly. And I think that's the reason why both of us kind of ended up becoming friends with, you're a few years out, Dr. Seidel, and you're still friends with so many of your co-residents, right?
We are 10 years out. We graduated 10 years ago this year, and we are all still best friends. In fact, we made our dinner reservations for AAP today, so
Oh,
we are all set.
What kind of food are you guys gonna get?
Thai.
Ooh,
nice.
okay.
Well, it
Always a
wasn't
good
my pick.
choice.
It was one of my former co-residents. He apparently said it was good in Scottsdale or something like that. So we're gonna go.
Oh,
Exciting.
awesome. That's great to hear.
Not to
Um,
deviate us from our topic today.
Yeah.
I
Sorry.
mean, you can't ever go wrong with Thai food, so I think it's worth a mention. Um, awesome. So, kind of getting more into the nitty-gritty of, comparing program to programs, do you think the call schedule, didactics, and elective opportunities, should applicants take into consideration when also making their rank list?
Yeah, I can start if you want. I think again it falls towards your own values as a person and what you
Mhm.
value and what you and how you work as a person. So if you know ahead of time, so we were talking about like metacognition today in the GMAC meeting, and knowing yourself and knowing how you think is helpful. So if you know that you can handle being on call in multiple locations at once, but having less frequent calls, that's good for you. I mean, maybe choose a program that is like that. If you know that you get a little overwhelmed when you're on call in many places, and you be more comfortable being on call at one specific place, but more frequently, then that's okay too. And you can take that and you can value how important is my call schedule to my overall well-being in the program. And then
Mhm.
sort of construct that again in a very personal way, not to look at statistics and just because your friends say that X program is the best program in the nation or Y program has the best research prestige, how does this particular program fit my personality and my way of learning and my way of thinking and my anxiety levels?
That's just as important. Yeah. Did you have anything that you wanted to add as well, Shahana?
I would echo everything that Dr. Seidel said. I think it's really important, the anxiety piece, actually. Now that I'm thinking about it, when I, rotated, I was lucky enough to do an audition here and felt very at home before, I ranked and ultimately ended up at UT San Antonio, which I was very, very thrilled about. Um, I looked at how I interacted with the attendings and how I felt asking questions and how comfortable that was. Were they approachable? Was it something where it was kind of a good mentor-mentee relationship that kind of occurred organically as well? And that's something that I felt pretty seamlessly with all of the attendings here. And that's how I also knew it would be a really good learning experience. Just the fact that I felt like very comfortable asking any kind of questions and learning. So I just wanted to add that little tidbit.
And not to like deviate us from our topic, that our question, but I think one of the most challenging things that I've seen from a student perspective is really being able to get the personality of a program when you can't necessarily visit and you're doing virtual interviews. It's really tough, and it's tough for us too on the program side to sit to try to glean somebody's personality and how they fit in like 10 minutes. It's just not feasible because we're all human. And so the more that you can interact with a program and so that you can feel out their personality as well as feeling and then having us also be able to feel out your personality, I feel like the better fit you'll ultimately come to.
Absolutely. And that's actually a really good segue to our next question. But before we move on, I do want to echo what Shahana said. I think with the feeling comfortable to connect, but also ask questions, right? Because down the line, that's how we grow. In residency, you don't have like the formal, I guess, beside like didactics, schedule or classes that you're studying and learning. Yes, there's some self-studying, but a lot of things happens during hands-on, right? If you're comfortable in asking for feedback and receiving feedback, that's the type of environment that will help you in your professional growth. And Dr. Seidel, it from the things you mentioned, it just sounds that it can go very far if we take the time to sit down with ourselves and make that list of what is my value, right? Because I think throughout this process, and the more audition rotations you do, the more personalities you interact with, sometimes that actually, and this is from more of like an applicant side, it can get lost in the sauce, right? Because you're going to all these different programs, they're offering different shiny things, and everything looks very exciting because it's your first time in that new environment. So, from the applicant side, you're just that's another reason why making that rank list can be so challenging because you're like, man, I loved all my auditions. I loved all the interviews. Everyone was so excited. Everyone was, showing me these or telling me these really fun things. And I think that's such an easy way to then the other voices kind of becomes your internal voice of, oh, these are my values. So I think it can go really, really far if whether that's you've made that before, starting your fourth year, or you're just super introspective, that all of who you are as a person and your values. So it just takes time. And I think that comparison piece was another thing you mentioned, and it's so hard not to do that, right? Because we as medical students, we all talk and it's just like, oh, what are you doing? This is what I'm doing. And again, it becomes so easy for other people's voice to become your voice, and then you kind of potentially forget some of the values that you had. So in saying all of that is that it takes very far for you to take the time for yourself to make that list and get to know yourself and know your values.
Yep, absolutely. I totally agree.
Mhm.
And if you're not a list person, constructing some other visual, maybe a vision
Yes.
board, however you want to construct your own way of understanding yourself better.
Yeah. I definitely am a vision board person, so I'm glad you mentioned that too. So
So not
you t
it.
so you touched on getting to know the cultures and how in a program, right? If you're not doing an audition rotation, sometimes it can be a little difficult because again, during interview, it's just all these positive things that is being shared with you. And how do you suggest that an applicant can go beyond what was presented on the interview day and get a better understanding of the culture of the program?
I would say, in my experience, reaching out to residents, usually at the end of the interview day, the residents would provide their email address, the ones that were on just, for the breakout rooms. Or you can always ask the coordinators as well if there's any residents that would be willing to talk to you. I think any interaction and the more interaction you can get with a program, the better. But especially from a resident's perspective, I think that's what I did for a lot of programs because I was during that, Zoom interview time as well. And so I was only able to rotate at one place, but I wanted to get a good feel for other places. So I spoke to individual residents about their experiences and how they interacted with the other, residents, even when they were interns. And I kind of got a great idea just from that as well, more about the ins and outs of the culture and kind of was able to glean a bigger picture and see if I could see myself going there.
Mhm. I think that's a really great point. The residents they expect students, and they like when students are, for the most part, I'm generalizing, but I feel like most of our residents and most of the residents that I know would be happy to connect and help the students because they were just there.
Yeah. No, that's a very great point. And I think for the applicant side, right, the residents are sharing their emails for a reason. There's definitely a lot of fear that comes like, oh, I don't want to be a burden. Oh, I don't want to overstep any boundaries or bother them. But people don't share their email address or their contact information if they didn't want to be contacted, right? So definitely use that opportunity. And these are thoughts that I've definitely had myself. Like I've overthought just sending a text message. And, once I actually did reach out, there's just such positive, welcoming energy from the receiving end and from the residents. And like you said, everyone likes the ones who are sharing their contact information, especially like to be contacted and answer your questions. So don't be afraid, y'all.
And that goes for attendings too. Like we share our information as well. And the program director, we do expect students, and they do reach out to us. And I'm glad when they do. And if I don't have a ton of time to answer something, I will do it the best that I can with the time that I have. But that doesn't mean that we don't want to respond there. So don't allow you send the email and then sweat it out, and don't think twice about it. Just do it.
Shoot your shot. That's like I feel like it's the best advice you could have when you're a fourth year. Like I feel like there's no loss. There's nothing that you're going to lose from trying to just connect with someone. And PM&R is such a nice field because everyone is so kind and wanting to pay it forward that I have not had one person that I've reached out to tell me like, oh no, I'm not able to talk. They're like, oh my gosh, yes, let's find a time. And doesn't matter how busy they are, and they will find a time in their schedule to meet with me, to talk with me, especially when I was a medical student, but even now as a resident. And it's so great. So
love it. Y'all heard it here first. Don't be afraid to reach out.
Maybe it's just the what is it, the Texan charm? Is there like some Texan charm or something? I don't know. I'm not from Texas, but
I want to say go big or go home, but that's not.
Yeah.
Just go big. Just shoot your shot. Yeah.
Shoot for the stars.
Yeah. I don't know if there's a big Texas.
Yeah.
There's one about hair, but I don't know about the
no,
bigger the
that
hair,
we're like in the South and people are nicer and more likely to.
They are, but
That's
I think but I feel like it's still universally true. Like when I went to AOCPMR and I feel like I was really afraid of the Northeast, and then Dr. Seidel's from the Northeast, and he's like the nice,
literally couldn't
ever.
get more north or east.
Yeah, exactly.
Yeah. Oh, wow. I think it's definitely a PM&R culture too. Yeah,
it is. It attracts a certain kind of personality, and I think that is not going to change ever, and that's the great thing about our field.
Oh, that's awesome. All right, that's a very good, realistic advice, because if you don't ask, you don't know, right? There are definitely interviews. It's very limited, virtual world. It's making our application experience easier, but also it adds, another layer of potential complexity that you don't get to know. So don't be afraid to reach out, guys, and shoot your shot, like we've said. Okay, so now kind of moving or shifting gears a little bit to highlight some of the lessons that you guys have, over the course of time, reflecting back, things that you wish you had paid more attention to when ranking, but in a medical student position, didn't really occur to you. So what would you say is a small but important detail about residency training that you wish you had paid more attention to when you were
I,
making your rank list?
yeah, I think something that I did not put that much stock into, and looking back now, I'm really lucky, was the size of the program
Mm-hmm.
for all the programs that I applied to. Because, in retrospect, I have a big class. I have 8 in mine, so 32 total in the program. And that's a lot of people. And I thrive with more people around me because I think I'm an extrovert. And so I like having the chance to be friends with more people. That was important to me. And that's something that I did not realize early on when I was ranking, and something that occurred to me when I actually matched and met all my fellow co-interns and realized what great bonds we had made. And something that I think other people should consider, because if you're someone who thrives with a smaller group of people and are a little more introverted, that might be something to consider. But I am very grateful that the bigger the class, it was better for me. So maybe in that sense, everything is bigger in Texas. But I really liked that was one detail that I think is important that maybe not all applicants consider. They think about, yeah, academic prestige, research, all these other things. But size of the program, I think, is something that might get overlooked.
And back when I was a student and I was applying, we didn't have geographic preferencing or anything. But I was and this is probably my only regret, is that I really restricted myself to the Northeast corridor. I was like, well, that's where my family is. That's where all my friends are. I can only really be in the Northeast. But in reality, as I said at the beginning of the podcast, 4 years goes by really quickly, and you make friends, and you can thrive in a program no matter where it is. If you want to go back to where you were from after residency is done, you can do that.
Mm-hmm.
There's nothing restricting you to stay where you train. Um, and I think I wish that I had expanded myself a little bit more, but that time maturity, and that's why you have people like me that are like 10 years out that are telling you to maybe think about the larger picture.
Yeah. Uh, for sure. I think the size of the program is, yeah, something that hasn't truly occurred to me because for me, for instance, the fit has been the biggest thing, right? And definitely being close to the family, and like you are mentioning, Dr. Seidel, I think, like you said, the 4 years goes by really quick, but in this and this other side of the applications that we're at, 4 years seems very, very long, right? But now once you're in attending, you're like, man, 4 years wasn't super, super crazy. So that's a very refreshing perspective to have. And again, that just goes a lot into knowing yourself and things that are important to you, to see if you are, you vibe more with a bigger group or a smaller group, and where you can be your most confident self. So we've talked about a lot of the things that you should do when you're making your rank list. Um, have you noticed any, common mistakes that applicants make when creating their rank list, or things that you shouldn't do? I think we kind of touched on some of it. Prestige per se shouldn't be something that is a determining factor of you making your rank list, but is there any other factor?
I just want to make one comment on the prestige. If
Oh,
prestige
sure.
is important to you, if prestige is personally important to you, then that can be a contributing factor to your rank list. We
Mm-hmm.
were just saying that it doesn't necessarily reflect on your greater ability to be trained in a good program, or to necessarily have a good fit, and that for us personally, the fit was more important.
Right, right. That's a good point. Um, Wonderful. So, do you guys have any ideas or things that you've seen regarding common mistakes for applicants when making their rank list beyond what was discussed so far?
I would say, kind of going along the lines of, 4 years feeling like it's just a very short amount of time. Even now, as a PGY3, I can tell you, like, I blinked and I'm here in my 3rd year, and I feel like I was an
Yeah.
intern yesterday. So it goes by really fast. It's like the days go by slow, but the years go really fast. That's kind of what they say in residency, I feel. But any applicants that prioritize fellowship match. I feel like you're too early in your training to really know, unless you're 100% decided and have a lot of experience in medical school seeing all those things. A lot of people end up changing their minds in terms of either doing fellowships, not doing fellowships. And I feel like just ranking a place based on if they have fellowships or not doesn't necessarily make a lot of sense. I think you should give yourself the option to explore what the program as a whole has, and if it gives you the opportunity to explore different fields of rehab, so just cancer, and you'll get great training with TBI, spinal cord, all of that, pretty much everywhere. But just making sure that you're not only picking a place just because you say, oh, I want to end up at that fellowship. First of all, because I think there are no necessarily guarantees, but I think just because a organization or program doesn't have a fellowship attached to it doesn't mean that it's not the right program for you. So I think something to consider.
I think that's a really great point. And I think anything that closes your mind to possibilities is something that you should try to avoid, because like Dr. Momin said, like you might start residency and think that you're going to be a sports doctor, for example, and then be on a TBI rotation, be like, wow, this is really cool. That's what happened to me. But so you really should be entering residency. You should be in all of your education, keeping an open mind and always being available for something new, and to take every experience as a learning experience. Yeah.
Wonderful. As a medical student, the experiences we have can be very different compared to a resident physician, because that will be genuinely the first time that you have full-on responsibility. And I can definitely see how that can alter that perspective, or just shows a very different side of a subspecialty or a focus area that you had no clue about, or you had general understanding, but not super interested. But once it gets to you actually taking care of the patients, then it opens a lot more of, oh man, I could maybe actually do this, or this is something that I'm interested in. Was this something that happened to you, Shahana? Actually, I'd be interested to hear. I don't know if cancer rehab was something that you were super interested in from the first day,
Yeah.
or.
So yeah, I actually came in saying like, oh, I really like cancer rehab. And it was actually one of my mentors here at San Antonio when I rotated that I really liked what he was doing. And then actually for the first 2 years of residency, I was like, no, I'm team no fellowship. I'm going to be a general physiatrist. I want to make sure I keep all these skills sharp. And then I entered my third year, which is kind of infamously known, I feel like, as like the career crisis year where everyone's deciding like fellowship, no fellowship, what do we want to do? So I decided that cancer was actually the perfect mix of everything that I was looking for, really good balance of like inpatient, outpatient, MSK, spasticity management, kind of touched on all of those things. And I love the patient population. And that's really what made me like fall in love with it and decide. So I kind of I'm one that kept an open mind in the beginning. And I do have like classmates that, were inspired by things they didn't think they were going to be inspired by, people that ended up falling in love with peds more than they thought. So I think for me personally, I came back around, but it was just kind of like a spark of something. I feel like I didn't truly understand it until I got into residency and I got to rotate in the cancer clinic and work with cancer patients. And even with my TBI attendings, when I got to do great spasticity management, made me realize how much I like doing spasticity management and how much I love doing Botox injections, that I realized I want that in my future practice.
Wonderful. So keep an open mind is what I'm hearing.
Yeah.
Awesome.
And I will say also, like, coming here, I was between a few different programs when I was ranking as well. And just, personal anecdote, there was a program that I was choosing that was attached to Cancer Center. And that was something that, as a medical student, I was like, oh, but if I match here, then I would get to do that. Maybe I would be a shoe-in for their cancer program, and that would, work out. And me having picked, what a place that was important for me to feel comfortable, where I could grow, where I could learn. My mentor, that same mentor that started out when I was a fourth year, has continued to be my mentor, has opened up the cancer rehab world for me, took me around AAPM&R, introduced me to pretty much, all the different people involved in the cancer rehab world. And so many people here have vouched for me. So I have zero regrets about picking that based on fit, because everything worked out in the end. And I feel like that's kind of the motto that I try to, keep as well, is that everything's going to work out if you kind of follow your heart, which is kind of cheesy, but true.
Yeah. Yeah, no, we love cheesy here. I'm a big
Yeah.
believer that everything happens for a reason. So I'm glad you shared that sentiment as well.
Yeah, we were actually just talking about that.
Yeah.
Oh,
Yeah. Yeah.
awesome. So, do you all have any advice for students who are struggling between two different programs or two similar-ish programs? I've definitely heard a lot from my friends that they're number one and two per se, they just for the life of them, like that you can't just make up your mind. What do you suggest that should be a tiebreaker, or how can you like pinpoint your number one versus number two?
I might be a little controversial here for a moment because we were just talking about everything happens for a reason. And
Mm-hmm.
if you really have gone through the ringer and you've looked at both programs and you love them both, and you're like, I don't know which one I want to put, one or two, just leave it, see what happens.
Oh,
But I
I've
know
wow.
also
most
heard,
people
I was
might
yeah,
not
not be able to
expecting
handle
that's
that,
that.
pretty
but
good.
What? My anxiety level is just.
You can also flip a coin. And then I
Hey.
feel like when they say you flip a coin and then you have someone else do it and you ascribe, like a heads for one, tails for the other, and then you'll know if you were disappointed with your reaction. That's what I've been told. I didn't.
Mm,
I was between two programs as well, and my best advice, and Dr. Seidel and I also talked about this, is just like go with your gut. And the hardest thing about all of that, I think, is quieting everyone else's thoughts and all the anxiety around making your rank list match day. Do they like me? Just go with what you felt was the right place. And if that takes meditation, because I did all that meditation, I went on walks with my dog, I did everything, and then honestly, don't stress
crystals,
about it.
chakras.
Yeah, exactly. Open your third eye, just zen out, just whatever you need to do, and don't stress about it. Because I stressed for so long, so
mhm,
long. Like I went to my mentors and I was like, I'm stuck. Like help me. And everyone is going to say, hey, it's your decision. We can only, give you this advice. And
mhm.
ultimately, you do need to make that decision yourself. But I would say, don't stress about it. Just go do your day to day things. Try to relax, and it'll come to you. And if at the very least it doesn't, then I would go with Dr. Seidel's controversial advice and leave it.
Wow.
And yeah, I know
And
that sounds crazy, but
and also don't forget that this is a match system. So just because you put something as number one and two does not mean that you're going to get number one. There is an algorithm and there is a degree of fate here that you just don't have control over. And I know it is so hard for type A's and for us as doctors to let go of control, but it's going to happen no matter what.
yeah.
I think that's probably why actually making that rank list is so stressful, is because you don't have control over it. And like you said, there's a lot of type A people who, I mean, you have to be in control to be a physician, know what all the details about your patients, and match is truly something you don't have control over. So I think it's kind of like beside like the anxiety, like making one, two, three, four, the rank list, that is also the other side of it, that lack of control that makes this whole process kind of
Yeah.
anxiety inducing. I never thought about it like that.
We were also just talking before about like pouring over all of these details and really like making sure that you like have Excel spreadsheets and all of this
Hmm.
and trying to make sure that like you have every piece and control over those elements like you were saying. And I think at some point um it becomes almost too much, right? And so
Yeah.
you can go over the edge
Hmm.
and become obsessed over a lot of the details. And I'm going to go back to something that I said earlier, that even if you get your fourth program, your fifth program, one, you still matched, and two, you really can tailor the program to your interest, to what your capabilities are. And and if it's an accredited program, you will still at the end of those 4 years be a physiatrist.
Hmm. That's a very healthy perspective to have. You know, you will be a physiatrist. That should be the goal. And a lot of programs are hopefully open and receptive to residents' feedback. So if it's something that you're super, super passionate about and potentially maybe not very well prominent in a program, that's something that you can work on, network, go to different conferences, connect with other residents attending. So the world is your oyster. Did I say that right?
Yeah,
Hopefully. So,
correct.
all right, awesome. I think we've talked a lot about everything, and there's definitely really well golden nuggets of advice towards the end. But is there any final words of wisdom for MS4s who are, stressing over making the right choice?
Pleasure, Momin. Let
Sure, I'll
them
go
shine.
first. I have one, I guess, quote, one nugget of wisdom that was the best thing during my entire rank process for me, that calmed a lot of anxiety and helped me kind of recenter and think about some of those things that were really important to me. And I think this would resonate with anybody, but don't think about where you want to be on your good days, because a good day can be great anywhere. Think about where you want to be on your bad days. What's going to be important to you? Is it going to be your family, location with your friends that you already know? Is it going to be your coworkers and the culture and the place that you're at and working when you have just a really, really bad day? Where do you want to be? And that actually really gave me a lot of clarity in this process. And I hope that the fourth years that are potentially similar to me would also benefit from that. Where do you want to be on your bad days?
Love that. That gave me goosebumps. That actually gave me goosebumps. So thank you so much for sharing that. Um, awesome.
I
Well,
don't think I
thank
could say anything else that would top that. So that's why I made her go
Mic
first.
mic
mic
drop.
So
drop.
I could keep my mouth shut.
I learned from the best. Okay, I'm giving
Aw,
credit to Dr. Seidel.
love it. Love to see it.
Yeah.
Alrighty. Well, thank you guys so much for listening to today's episode. If you found it helpful, please share with your friends and colleagues. And if you have a few seconds, please please leave a review on our Spotify or Apple Podcast page and let us know what you'd like to learn about in the future. Until next time.